Hey everyone, so session 9 completed today. Also having a bit of a bad hair day today. Can you see that I'm back to front on the camera, but I've got little, is it this side? Anyway, carry on. I'm appreciating having a bad hair day, having had no hair for a while. So session 9 done, 9 down, 1 to go. Drive, so I had my review today as well as my radiotherapy, so it'll be a bit of a longer update today, but hopefully not too long. So drive time in today was an hour and 11 minutes. I had my review at 3 o'clock. I arrived at 3 o'clock. I was called in at 3:19 and I was done at 3:39. So that was 20 minutes in the review. I then walked round to radiotherapy, which is in a separate area from the clinic, and arrived there at 15:32, so 3:32. I was called in at 3:58 and then I was done by 7 minutes past 4. So my actual radiotherapy was 9 minutes today. No images, just x-rays to the area, or radiotherapy, radiation to the area. Drive home was an hour. When I put maps on, it was saying an hour and 13 minutes, but that went down as I went along, so I was grateful for that. And I did 5 breath holds today, nice and simple, just the breath holds, no long ones because there was no imaging, and that's number 9 done. So on to my review. So the review is just to check in how you're feeling, how the area that's been treated is. Have you got any, is your skin broken? Is it sore? Thankfully for me right now, my skin's not sore. Sorry, my skin is sore, it's not broken. So yeah, there's no breaking of the skin or weeping or anything, which is great. They had a look and said it looks fine. I learned today that the radiotherapy is actually delivered to like a rectangular area, and that area will be sensitive for the rest of my life. So in terms of being in the sun, they say for the first year, just try and keep that bit covered up. It will always be sensitive, use factor 50, but for the first year, try your best to keep it out of the sun. Which, there's other parts that I can be exposed to in the sun, but I love the sun. So there's that. They said to continue with regular moisturising for 4 to 5 weeks after I finish. That the symptoms will peak 10 to 14 days after radiotherapy finishes. So that's when, if there's going to be any soreness or breaking of the skin and the fatigue's going to really kick in, it's going to be 10 to 14 days after I finish. So we're looking at towards the end of next week for that to happen. The area is darker, that's also normal. So it's normal that the skin gets darker during the treatment. There's also internal soreness, and he said that people underestimate how long it takes for the internal damage that they do with the radiotherapy to be fixed or to heal, essentially. And that he also explained that all of the work that they did in the surgery has kind of been undone. So I've been getting some soreness, tightness and more numbness under my underarm because I had lymph nodes removed during my surgery. They said that that's normal because essentially the radiotherapy is undoing some of the stuff they did in the healing that was done after my surgery, because it's going at the nerve endings, and so that's what's causing the shooting pains that I'm getting and the sensitivity around my nipple, like super sore. They said to just wear like really loose clothing, not the best but easy to get on and off for radiotherapy, loose clothing around the house, and at night just to try and leave it to give it air. So I'll be working on that. They said to keep doing my exercises. So after surgery I was given some exercises to do, and I have been doing those maybe like once a day. Probably should be doing them about 3 times a day, so I need to try and work on that because the area is getting tighter. They said that it will loosen up again, but again the effects of radiotherapy are working on that. I need to stay hydrated. Hydration is really important. It will take a while for the fatigue to pass, which I knew already, but yeah, like people keep asking me how I am. I keep saying I'm tired, and I said to a couple of friends this weekend I probably need to use the correct language and say I'm fatigued or exhausted, because that is how I feel. Like today I had to go out for a walk before I got in the car because otherwise I wouldn't have made it. So yeah. Sunscreen I've talked about already. They said to avoid pools and jacuzzis for now, but if you do go into them, maybe a couple of weeks after, maybe 2 to 3 weeks afterwards, and wash really well, because the chlorine can cause irritation because the air is so sensitive. And yeah, I think that's it. I also got this leaflet which just has a load of stuff in around follow-up, skincare, fatigue, swimming, sun exposure, loss of appetite, different things, and a number to call if I need any support from them. They said that if I do get really bad skin issues, there's bandages that they can prescribe or dressings they can prescribe to help it to heal. So to get back in touch with them if that happens. So that's session 9 done. I am trying to stay hydrated. I am continuing to use this cream, La Roche Cicaplast, Balm B5. I'm going away from the camera there. I'm also using the La Roche Lipikar cream. I don't know why, because it's back to front. There we are. Okay, yeah, that one. And I'm also, especially at night, because at night, you know, I'm just leaving it on, using this Aquaphor cream. This is more of an ointment, and so at night time I lather it in that because I want to try and keep the areas hydrated and protected as possible. So I think that's everything in terms of symptoms today. Absolutely so tired and sore, and yeah, I think that's everything. So I'll see you again tomorrow for session 10. Almost there. That's it for me. Juices.